Lewisburg acupuncturist Trey Casimir talks about treating veterans for symptoms of post-traumatic stress disorder and other ailments.
It's not my specialty, but I first saw articles about this 12 or 15 years ago. And simultaneously, they discovered that this very simple ear treatment, needles in the ears, is very effective for people suffering from PTSD, and also is very helpful for people who are just experiencing a lot of agitation. And so for getting wounded soldiers off the battlefield, the previous, so many additional injuries were caused just by them thrashing around while people tried to get them off. Usually they would inject them with a bunch of morphine, but that had other dangers, respiratory, other kinds of issues, and they discovered that
addiction.
Exactly. And they discovered that using these points in the ears was as effective as morphine and didn't come with all those side effects. So right away they started training their battlefield medics in battlefield acupuncture and equipping them with little packets of ear needles.
What are some of the ailments, what are some of the issues that you have dealt with over the years?
Well, mostly pain, chronic pain, and there frequently is some PTSD kind of tangled up with the chronic physiological pain. So a typical patient might have been blown up in Iraq and have suffered headaches and back pain ever since, but also can go back to that moment of terror and chaos and confusion in an instant, and it all gets tangled up together. So from a body, mind, spirit point of view, which is what acupuncture is, all of that stuff goes together in a kind of a predictable way. You can see what emotions are involved. You know, some people aren't scared, they're angry. And then combine those...
That's PTSD, yeah.
In all different kinds of situations. Yeah. And if those things go together as you expect, then you can have a more efficient, more effective acupuncture treatment. For 5 years now, I think, I've been a participant in the Care in the Community program that the VA has run.
Uh-huh.
This is especially for rural areas like ours where specialists may be in Philadelphia or New York or Pittsburgh or someplace. And I don't know what their specific rules are, but if there is not a specialist available within the VA network, they contract with people like me who are allowed to see veterans under the VA program. I manage all the billing and authorization and everything like that with the VA. All the vet has to do is contact his VA doctor, get a prescription and authorization, and then come see me.
So you're covered.